Next bone is the hyoid bone. It's a very tricky bone in the sense that it's very interesting in a particular sense that this is, I think, the only bone in the body that is independent of rest of the skeleton. It is not connected to the any part of the skeleton, axial or appendicular, with the body. Let me show you where does it lie. So if we look at the bone here, you can see it is floating, almost floating. It is only connected by muscles and ligaments that are not shown here. This is the hyoid bone. This is the hyoid bone. The hyoid bone, it is originated from the partially second and partially third pharyngeal arch. So the basic take home message, the bare minimum you should know about the hyoid bone is that it the name of the three parts. Let me move to the presentation. The bare minimum is to know the three parts. This is the body. The projections, smaller one that are on the top, that are the lesser cornu, and the projections that are going backwards and sideways, that are bigger one, that is the greater cornu. For most of the practical purposes, knowing the names of the three parts gets you by. However, we are the students of anatomy and we are the teachers of anatomy, so we won't uh, let you go by such easily. So it has body. Body has a little convex anterior surface and a little concave posterior surface. Anterior surface is facing like this, anterior and superiorly. Let me show you right here. This is the anterior surface. Okay, this is the anterior surface, and the anterior surface, the thing that is to be remembered here, so it has two surfaces. The anterior surface here is the posterior surface, and there are of course two borders, the upper and lower one, and there is this in the midline. This ridge in the midline, it is called the median ridge. Simple. The body has convex anterior surface divided by median ridge, posterior surface, that is red, and median ridge. Another thing about remembering for the exam point of view, that these two parts, the body and the horn, they are joined with in early age, या कहना चाहिए before middle age. There is a fibrous joint here. They are not as a single bone. That is a joint, fibrous joint between these two. But with time, as the age progresses, they fuse with one another and they become a one bone. So we talked about the location, the origin of the hyoid bone. Let's move on to the